So BPH is basically a condition that affects all men as they age. And to a greater or lesser extent, some men have more symptoms, some have less. And typically they may have problems with weak stream, frequency, urgency, getting up at night to urinate, which is affecting restful sleep. So that's the problem. It's due to the enlargement of the prostate. It's a benign condition, but it's very common. Treatment options basically start off with medical therapy, depending on how the patient presents in terms of severity, but most men come in when the symptoms aren't too severe. And so we will start with some combination of medications or a single medication. When that progresses, which oftentimes it does over some number of years, then we have to look for what's called the MIST options, and that stands for minimally invasive surgical techniques. Resume is one of many, and it's one that we offer in our practice. It's a very interesting, I think, culmination of technology that's progressed over many years, and basically it's a water vapor convection therapy. So what that means is it is a technique to introduce steam into the center of the prostate, and then over several months the prostate shrinks back and the symptoms are relieved. Resume differs from many of the other procedures that we offer, that we can do it in the office under just local anesthesia and maybe with a mild sedative. So it's very short. The whole procedure takes probably less than 10 or 15 minutes. The actual introduction of the steam, which can be as little as 3 applications per prostate or as many as 10 or more, each application only takes 9 seconds. So we try and ask the men, can you just put up with this for a little bit? We give them numbing medicine and things like that to take the edge off of it. But most men tolerate it quite well. We have to place a catheter, and that's a hard thing for some guys to accept. But I tell them, if you had your knee worked on or you twisted your ankle, you'd be in a cast for a couple of weeks. The catheter typically stays 3 days, maybe up to as many as 5 days. And then there's a period of about 3 weeks where they have increased irritative urinary symptoms such as urgency, frequency, those sorts of things. And then after that 3 weeks, they turn the corner, and generally by about the 3rd month, they've gotten to the maximum degree of relief of their symptoms. And at that time, hopefully they'll be able to come off their medicines. And that's really the goal. The studies are only 4 years old now. They're still somewhat immature, but they show that 80% of the men have durable relief up to 4 years. So it's just like anything else. It doesn't work in everyone, and the key with these selection of these different techniques by the surgeon is patient selection. So you have to make sure that the prostate size proper, the men's symptoms fit this, and there's some anatomic things that we have to consider, and that makes a decision on whether we offer Resume or we offer something else. Well, you don't burn any bridges with Resume, which is one of the things I like about it. I've done urology now almost 30 years, and I've seen a lot of technologies come and go. But the nice thing about Resume, the fact that it can be done under local, it's outpatient, patients tolerate it well, and if it doesn't give them the outcome they like, you can always go to plan B, C, or D.